Hello, this is Shawna Gargan performing my final physical assessment video for Southern New Hampshire University Nursing 545.
Come in.
Hi Brandon, my name is Shawna. I'll be your student nurse today. I'm going to perform your full physical assessment. How are you today?
Good, how are you?
Good, thank you. I'm just going to start by washing my hands and draw the curtain. Can you tell me your name and date of birth?
Brandon Martin, 31596.
Great, I'm just going to verify that with your armband. Wonderful. And do you know where you are today?
I'm at the doctor's office.
Great. Do you know why you came in today?
My yearly physical assessment.
And can you tell me your name and, can you tell me today's date?
2/14/21.
And who is the current president?
Joe Biden.
Great. So I'm going to start by assessing your head, eyes, ears, nose, throat, and I'll be palpating your head to start, okay?
Okay.
All right. Thank you. Alright, so I'm just going to start at the top here. I'm going to check for any lesions, bumps, masses, assess the skull, just look for anything there. Check behind the ears. That looks good. Alright, no issue there. Just going to go ahead and step back. I'm going to take a look at your, no, you can look straight. I'm going to take a look at your face and your neck. Make sure everything is symmetrical. Can you smile for me? Great, that looks wonderful. I'm going to go ahead and feel for your temporal pulses. Alright, and now I'm going to just palpate your sinuses. Just let me know if you have any tenderness there. Any tenderness or pain? Anything?
No.
Okay, great. Alright, anything there?
Nothing.
Great. Now if we were in the office, we'd be looking in the ears with the otoscope, making sure that the drum is pearly and gray. We want to make sure that the drum is intact, there's no erythema around, no excessive wax, anything like that. We'll do the same thing on this side. That looks good. Okay, you can look at me. We're going to just take a pen light here. I'm going to check your peripheral vision if you want to look straight at me. And just say yes when you can see the light in your peripheral vision, okay?
Yes.
Okay. And I'll check this side.
Yes.
Great. I'm going to take a look in your eyes. I'm going to shine the light. You can look straight at me. And that's good. There we go. Okay. Sclera is white and intact, no jaundice noted. Pupils are equal, round, and reactive to light and accommodation. I'm just going to take a peek up at your nose. The nasal passage is patent. Can you blow out of each side? Good. No drainage or anything noted there. I'm just going to take a peek in the throat. Open up and say, ah. Good. Tonsils look good, not swollen or anything. You can just stick your tongue out for me. Look down a little bit. And point your tongue upwards, downwards, and left to right. Great. Looks good. No erythema in the throat noted. Do you have a sore throat or anything like that?
I do not.
Okay, good. Alright, now I'm just going to feel for your thyroid. I'm going to get behind you and just feel for any tenderness here. Any tenderness?
No.
Okay, good. Now I'm just going to feel for the lymph nodes. I'm going to start at the eyebrows and then work my way down around the ears and then into the armpits.
You have lymph nodes all in there.
Mm-hmm.
Wow, that's a lot.
Going on the clavicular line here. And into the armpits. You can put them down. Okay, there's no lumps or masses or anything like that. That's good. Next, I'm just going to grab my stethoscope and then listen for a bruit in the temporal artery. While I'm here for the neck assessment, I'm going to go ahead and palpate my carotid. You want to do one side and not both because the patient can pass out if you do both. And carotids and temporals are 2+. No bounding or thready pulse. I'm going to listen for a bruit in the carotid. Okay, no bruit heard on either side. Now we're going to go ahead and do a cardiac assessment. We're also going to look at the skin. Prior to doing the cardiac assessment, I'm just going to take a look at everything here. Skin looks good. No scars, scratches, or bruises. No tenting. Good integumentary. Cap refill, less than 3 seconds.
Been working out.
Okay, we'll check the legs. Capillary refill's good. Okay, that looks good. Feet look good, skin looks good. There's no lacerations, abrasions, masses, anything like that, no bruises. Capillary refill is less than 3 seconds throughout. So we'll continue on with our cardiac assessment. We're going to listen to the heart from the front. And our 5 points with the diaphragm first. Now we're going to listen with the bell just to make sure there's no abnormalities there. Alright, and there's no murmurs, gallops, clicks, or rubs heard. We can hear S1, S2 throughout, all points. Next we're going to go ahead and check our brachial pulses while we're here.
Ooh, sorry.
Okay, 2+. And 2+ on the left radial. 2+ on the right brachial. and 2 plus on the right radial. If you wouldn't mind just laying down for me, we're just going to check your PMI.
Do you have a preferred side?
If you can lay on your left side, that would be best. Okay, so we're just going to go from the midclavicular line, 5th intercostal space, and we're just going to palpate here, and we're looking for the point of maximum impulse. Okay, that's good, so you can sit back up. Great. Alright, so now we'll continue on to our respiratory portion of the exam. I'm going to have you say 99 as I have my hands down in a few spots here.
Okay. 99. 99. 99.
Okay. And I'm going to take a listen to the front.
Okay.
You can just take some breaths for me.
That's a good one.
I'm just going to lift up here a little bit. Okay, now I'm going to take a listen from the back. If you can just start by saying 99 again when you feel the stethoscope touch.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, now if you can take some deep breaths for me. Alright, I'm just going to percuss the back here. Okay. And I'm just going to percuss the front. Okay, lung sounds are clear throughout. Bronchophony was negative. So we will continue on. We'll do a GI assessment if you wouldn't mind laying on your back for me. While we do that, we'll also check your other pulses. Alright, so I'm just going to check for femoral, popliteal, and then a foot pulse was the dorsalis pedis and the posterior tibialis, and then we'll check for a bruit with those.
Okay.
Okay, right and left femorals 2 plus. Right and left popliteals 2 plus. And our right and left posterior tibialis and dorsalis pedis pulses are 2+. So we're just going to listen for bruits now. We'll start with the femoral pulse.
Sorry.
Okay, and no bruit heard in any of those pulses. So now we'll continue on to our abdominal assessment. Are you having any abdominal pain today?
No.
Okay, great. If we were in the office, we would start by examining the abdomen, but we're not in the office. Our patient isn't in a Johnny, so we won't do that here today. But we'll start with listening from the right lower quadrant clockwise over, and then we'll work on light palpation, percussion, and then deep palpation. So we'll listen to start. So we have normal active bowel sounds in all quadrants. We'll continue on with our light palpation now. Anything tender?
No. Nothing.
Okay. We're in the right upper quadrant, and this is where the liver can be palpated from. And we're in our left upper quadrant now, and this is where our spleen can be palpated from.
Touch my spleen.
Now we're in the left lower quadrant. Any tenderness anywhere?
Nothing.
We're going to go ahead and percuss. Nothing feels hollow or anything. We're going to continue with our deep palpation, looking for any masses. Any tenderness or anything there?
No.
Am I tickling you?
A little bit.
Sorry.
That's fine.
We can also press in here, and if we're looking for the aorta, you can typically feel it in here. I'm having a little bit of a hard time landmarking it right now.
Well, I'm thick.
I think I can feel it right here. If we reach around the back
just trying to find a needle in a haystack.
if we reach around the back side, we can feel for our kidneys. No, kidneys are not palpable.
I can adjust.
Okay, and then kidneys on this side are not palpable. Alright, if you want to sit up, we'll continue on with a musculoskeletal exam and a NUR. We'll start with the musculoskeletal pieces, which is more like the strength and the movement and everything like that. Can you put your head forward for me and put your head back, side to side, left and right? Good. And can you do a full circle with your head? Great. Be able to lift your arms and put them down. Great. Lift your legs, put them down. Good. Okay, stand up, bend forward, and then back. Good. And then walk forward.
Oh, sorry, just stretching.
That's okay. And then back for me. There's no instability in gait. The gait seems normal. You can sit down. Alright. And now we'll go ahead and test your strength. If you can, turn your neck. Don't let me push it back. And the other side, don't let me push it back. And shrug your shoulders. Don't let me push them down. Good. If you want to hold your arms out, don't let me push it down. Don't let me pull up. And rotate your wrists. Rotate like a circle. Good. And don't let me push down. Don't let me pull up. Good. Do the same thing with this arm. Oh, yeah. You want to hold your arms like this. Don't let me push forward. Don't let me pull back. Good. And this arm, don't let me pull. Don't let me push. And then if you want to hold this arm out, don't push up. And don't let me push you up. And rotate this wrist. Good. And don't let me push your hand down. Don't let me pull it up. Good. Okay, so we will also check your legs. You can kick one or two out. Alright, and don't let me push it down. Don't let me pull it up. And same thing with the knee. Don't let me push down. Don't let me pull. Don't let me push. And same thing with the knee. Good job. Okay, now we're going to do the same thing with the feet. Push down like you're riding a car. And pull back. Great. Same thing with this foot. Push down like you're driving a car. And pull back. Good. Now we'll check your reflexes if you want to sit up. Typically we would have a tool to do this. If you want to bend this arm, we'd hold like this and we use our tool to hit the back of the tendon here and watch for a reflex. Do the same thing on both arms. And we'll do the same thing with the knee area. And then behind the foot here by the ankle. Okay, great. So we'll do that. And then I think that's good for the musculoskeletal. We'll move on to the neuro test. So if you can smile for me. If you can smile for me. And then frown. And close your eyes tight. I'm going to have you keep your eyes closed. I'm going to have you smell something. You can close your eyes and then smell. Tell me what this is.
Alcohol.
Okay, great. Alright, then I'm going to continue on. I'm going to see if you can feel. Can you feel me touching? Keep your eyes closed.
Yes. 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 Yes.
Okay, now I'm going to have you, I'm going to touch you with an object here. It's going to either be soft or sharp. So you can just tell me whether it's soft or sharp, okay? This is soft, and this will be your sharp.
Okay.
Alright?
Mm-hmm. Sharp. Soft. Soft. Sharp. Soft. 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 Sharp. Soft. Sharp. Soft.
Okay, great.
A little sharp there.
Alright, so I'll have you keep your eyes closed and put your hands out. I'm going to put an object in each hand. You can tell me what it is.
Key or key ring?
Yep.
Big clip.
Okay, I'm going to switch it up. Okay, you can tell me what this is.
Q-tip. Broken Q-tip. Paperclip.
Okay, great job.
Now it's a broken paperclip.
Alright. And then we'll continue with the neuro assessment. I'm gonna have you follow my finger with your eyes. You don't want to move your head at all, okay?
Like the Hunger Games.
And if you can touch your finger to my finger and then your nose. Sorry.
Joking me out. Okay, Randy Moss.
Okay, good job. Now I'm going to give you a piece of paper. It's going to have instructions on what to do on the piece of paper. I want you to read it and then do what the piece of paper says.
Fold this piece of paper and put it on the floor.
Perfect. And I'm also going to just have you close your eyes again and put your hands out for me. And I'm going to draw a letter on your hand. I just want you to tell me which letter it is.
A.
Okay. I'm going to do the other hand.
S.
Yep. And we're going to do a number on this hand.
2.
Yep. Great. And we'll do a number on this hand.
8.
Great.
It too felt like an S.
Good job. Alright, so now for the last thing we're going to do is have you, I'm going to say a few words or a phrase.
Okay.
You'll remember that. Then I'll have you count to 50 by tens. And then I'll have you repeat the phrase or words. So the phrase is going to be pink, red, blue, yellow.
Pink.
Now you can count to 50 by tens.
Oops. 10, 20, 30, 40, 50. Pink, red, blue, yellow.
Good job. All right. Did you have any other questions for me?
No, I think that'll be it.
Okay. And that concludes our physical exam.
Now, if it was a real one, I'd be like, where can I get that one with the D letter?